Mark. So we're going to get started. I want to welcome everyone to How Healthy is Public Health? How delicious and exciting is public health? It's going to be a fun ride. I'm really glad you folks are joining us. You guys really picked the right one. We have a great group of people here today. So why don't we get started? I just want to remind folks that there's evaluation that's going to pop up after this. So if you could just give any feedback that you have for us, Uber 5 stars, that's great. We would love that too. So if we go to the next slide, Thaddeus will be my lovely Vanna White co-host on the slide deck. So hey, it's me, your moderator. My name is Peter Tuiola Senga Silva, Talofa Lava. I am the Executive Director of Hawaii Island HIV Action on the Big Island of Hawaii. I'm currently in Hilo. I thought this was a great one to be in because also with the Department of Health and in public health. And I was a prevention director and Pacific trainer at which is now H3RC. So it's good to be a part of that great H3RC legacy. We have great here at HIHAF, which is our loving team. We do HIV and hepatitis treatment. We do care and also testing, gender affirming care, case management, a whole slew of things for our Hawaii community, which we're really, really proud of. So now I'd like you to meet our debaters. So debaters and news. Why don't we start with May Rose? If you could introduce yourself.
Aloha kakahiaka and magandang umaga sa inyong lahat. I'm Rose de la Cruz and I'm an assistant researcher at the University of Hawaii Office of Public Health Studies. We're located with the Myron B. Thompson School of Medicine. I am a local public health researcher here. I currently reside and occupy space as a settler, and I know that I live on occupied and stolen lands of the Kanaka OEV. My research is mostly on adolescent health, on underage drinking prevention, tobacco use prevention, and I also do cancer prevention with Native Hawaiians, Pacific Islanders, and Filipinos, looking at vaccine preventable cancers, specifically on HPV vaccination. Thank you for having me here, and thanks to my friend and colleague Thaddeus and Peter for joining me in this great session.
Awesome, thank you. And our other debater, Thaddeus.
Aloha everyone, hi, this is Thaddeus. Happy New Year, or as we say in Vietnamese, Chúc mừng năm mới. So excited to be here with my friend and debater, May Rose, although I'm pretty sure we agree on most things. I'm the current viral hepatitis prevention coordinator in the Harm Reduction Services branch in the Hawaii Department of Health, occupying land in what is currently known as Honolulu on the island of Oahu. I am also working I am the co-director of the Hep Free Hawaii Coalition, which is a community-driven effort to eliminate hepatitis and related harm. So very excited to be here because harm reduction is actually one of our core values. And I'm also co-chair of our sexual and gender minority work group, which is a community coalition with the Department of Health to address, again, sexual and gender minority issues and related harm. So I always love to add and related harms, because really just showcasing that public health is not only just health, but all the other issues that come with it. So excited to be here and to talk with you all today.
Awesome, so great to have you master debaters for today. We're very excited. So it's a fun debate. You know, we're gonna be looking at the two sides of public health. We do not want any craziness that befell the Capitol yesterday, which was absolutely ridiculous. So we wanna keep it light. We wanna make sure that we get both sides of what public health is, the good and the bad. So I just wanna establish a couple ground rules. You know, safety first. You know, do take a break if it does if some content is triggering. Also acknowledge your own privileges. You know, we all come from different backgrounds. Some people come from some areas of my life come from privilege and some don't. And it's just acknowledging that, respecting different perspectives. I know we all come from different angles of life and see things differently. Also step up, step back, and do participate in the chat. I do want to check in with our moderator for chat and questions. Do participants have the capability of doing that?
So for the chat, they can put questions on the website, and then all that will be on top of there. So we just have to look on the website to get those questions.
Okay. And if I do miss that, if you guys could just jump on in and let me know. Okay. So next slide. I want to wish you guys a happy new year. Happy New Year 2021. And I would be remiss not to talk about what has been on the subject of the news for how many weeks. It's our wonderful tradition of fireworks. And so our fireworks, there was like an official ban in 2011 of fireworks. And it even started before that. There was like permits on firecrackers. And when that started to happen, I think it's been a debate in Hawaii for a long time. There was a New York Times article in 1982 about Hawaii dealing with its fireworks. In 2011, under public health for injury prevention, clean air, the ban passed finally. And so it even like banned sparklers. So it was a very severe ban. And so what you see today, I don't know if you saw some of the videos from this year, but people were parked along the freeway watching all of these illegal fireworks go off. And I think the police were like, if you see anyone doing it, report it. I don't even know how many arrests there were, but there were very, very few. And I think what comes up for me, and it's not necessarily in this public health debate, but just harm reduction in general, that if you ban something outright, people are going to find a way to do it. And with fireworks, that's something we've done from little kids. Our parents did from little kids. We had Roman candles. We shot it at each other. We popped firecrackers, and one of the family members, their hand would blow up. It just, that's what it was. And so because of that, there was a complete ban on fireworks, but I don't know if there was necessarily great input from the community. And it's something that folks just love to do. And so now it's totally gone underground. It's pretty much turned into defiance if you look at it, the way that everything's popping up. If you watch the video, and I wanted to play a video, but sometimes it just doesn't work on Zoom. But as you watch each one, I mean, it represents illegal drugs to me, or illegal hormones. Everyone that pops up, that's a baggie of coke, that's a hit of meth, that's heroin. That's all of the drugs that are coming into the state because they are illegal. And somehow all of it is getting through. So it's a really wake up moment for us just to see. Every time I see the New Year's and July 4th, it's like, how are we really doing banning drugs and steroids and hormones and all of that stuff from our state? Obviously, it gets through. So, when your drug dealer tells you, oh man, I got the fire for you. Well, now I know what it is. It's the fire from the fireworks shipment that came in. Yeah. So that's something I just wanted to share as a side note, but I've been in this harm reduction for a very long time. I was with the plenary speaker at one of the second ones, talking about harm reduction and how we can use it with those with mental health. And I'm just really glad that we have this time together as harm reductionists. It's really sad that we can't be in the conference together because it's so great to reconnect with everyone that we see. But hey, on the bright side, we're getting into people's bedrooms on harm reduction through Zoom. So hey, we're making strides. Next slide. So let's talk about one of the harms of harm reduction first. And let's bring it home to Hansen's disease. So next slide. So Hansen's disease, I mean, it's very scary. It's very, not so much rampant, but it was going around the kingdom. There was a physician from elsewhere that came in, and he suggested to the king, just like the beehive collection that he had in the back of his yard, he would notice that any of the bees that were defective or had a disease, they would kick them out of the hive. And so what he suggested is that we go around and start collecting people that have Hansen's disease and throw them in this Kalaupapa sediment on Molokai. And a lot of people were misdiagnosed. It could have been eczema, it could have just been a rash. They didn't care. They would round you up in Honolulu, put you on a ship, and then you would be thrown overboard or put in a boat that would most likely crash on these rocky cliffs, and taught to defend for themselves. And it ended up being 8,000 people ended up going to this settlement. One of the sad things is that people actually, if they saw something on their hands or their body, they would take to the hills and they would hide with their families. And some of them even died. There was a great play put on by Kumu Kuhua about a story of someone that did that in Kauai. Some of the family members felt bad and they would actually go with those that were going to Kalaupapa, and they were called kokua. And these kokua were negative for Hansen's disease. And what happened was someone from the Board of Health in Oahu named Dr. Arthur Moritz came over, and he started doing experiments with these kokua. And he would take the sores of those with Hansen's disease and infect the kokua with it. And a lot of times it didn't work because a lot of people have natural immunity to it. So he would constantly try and infect them with different ways by scraping their skin, infecting the cocktail that he created. He would take mosquitoes and put them in a box that he put on Hansen's disease patients, and then put that box for hours on people that were negative. People still had babies at that time. They would take those babies as soon as they were born, and they would take them up that switchback that goes 2 miles up to the cliffs and send them into foster homes. And then they started sterilizing people, which is absolutely mind-blowing to me. So they would say, oh, you could come to Honolulu for treatment for this disease, but you would have to be sterilized. And if you didn't want to be sterilized, you would not get treatment. And so they kept, it wasn't as popular for people to go round up people, but what they did was say, hey, you could come in for free treatment in Honolulu for this disease. And if you tested positive, you were locked up right then and sent off on a ship. It was an absolutely horrible, horrible time. The treatment was already available in the 1940s. But still, it wasn't until 1969 that they ended isolation over there. And I was able to hike down with a family from Molokai down those switchbacks. And it's a beautiful, beautiful place as you're going down. But as soon as you hit the bottom, you really feel the pain and suffering that went on for our people. It's a very sad mark in our history. So next slide. So on the other hand, with public health, we've seen a lot of great things come together. And next slide. So for polio is a very devastating disease. It's an enterovirus. It causes disfiguration within 2 to 4 days. So as soon as you get it, within a few hours, a few days, disfigurement would happen. The damage would be done to your system. And so summertime is when it would really hit. And people were very afraid to let their kids out and play with one another because of polio. But luckily, Dr. Salk was able to come up with a vaccine in 1955. And with public health, they were able to actually immunize everybody in the United States and eradicate it. And then globally, a lot of public health people came together along with the private sector like WHO, the WHO, CDC, Bill Melinda Gates Foundation, we've been able to reduce polio to 99% globally, which is a great, great success story because the detriment of what happens with polio is so severe. So kudos to that. Next slide. Syphilis, next slide. Syphilis has a long history. It was a mystery for such a long time. It's one of the diseases, sexually transmitted diseases from the beginning of time. That was something that Captain Cook brought to the islands, and hundreds of people died because of that. And so our federal health system worked with Tuskegee University to bring in 600 Black men in 1932 and run experiments. A third of them were not positive, 2/3 were positive. And so they ran experiments on these people. And they would give them misdiagnosis. They wouldn't tell them it was syphilis. They would give them placebos, and they would watch and see what would happen to these poor men. And these folks were sharecroppers in Alabama, and they still had partners that they could have infected as well. So who knows how many countless women and children had also died because of this experiment. 15 years later, after this started, there was treatment for this, but it did not stop until 1972, until a reporter broke the news. And once they found out, there was huge public outcry about what had happened here at Tuskegee. I know President Clinton, he came out in the 90s and said it was one of the most shameful times in our history and extremely racist policy in biomedical research. One of the big themes that I've seen with Hansen's disease and also with this Tuskegee study was that people that were poor, that did not have health care and were sick, were promised free health care. That was the draw in to get them into this study, which is extremely sad. Next slide. All right, next one. So I know with HIV started back in the 80s. There was no funding for it. The government didn't want to talk about it at all. It was a horrible time. And a lot of our white gay male brothers who had HIV, they were at the forefront of this cause, fighting tooth and nail, being outspoken as they could to get funding and medicine, life-saving medicine out to the people. So fast forward to 2012, now we have gay and bisexual men and people of color in the CDC. We've discovered PrEP. And so PrEP is an HIV medication that a negative person can take, and they're pretty much guaranteed not to get HIV if they use it consistently and correctly. So with this, they recognize what it could do. Public health put it out. They spent lots of money on studies, on research, on marketing. CDC gave us money in the state for us as epidemiological specialists when I was with the health department to go into the doctor's office to share information with them. There was a lot of stigma for some doctors saying, hey, I'm condoning people getting HIV. And so we had to go in and educate them and show them what a great harm reduction model this is for PrEP. And that also is undetectable and untransmittable, saying that if you're an HIV positive person, if you do not have HIV in your blood, when we do blood tests, it's virtually impossible for you to transmit it to somebody else. And so this is a great harm reduction message rather than condoms, which works at some point, but we still had huge rises of HIV. With PrEP, with U equals U, we've actually seen in the big cities, HIV dropping finally, which is extremely amazing. So kudos to public health for doing that. Next slide. So that's a little bit of background about the history of public health and when it comes to trying to combat the things in our society that affect us health-wise. And so what I wanted to do is just turn it over to Thaddeus first and May Rose. And so Thaddeus is kind of going to give us a view of not necessarily the harms of public health, but maybe where public health has failed. And May Rose will be on the other side of the debate, being that champion for public health, which many of us are in anyway. So with Thaddeus, what is the value of public health?
Thanks, Peter, and thanks for that great introduction. It's interesting because this slide, I think, for a moment was called, "What is the value of public health as an institution?" And maybe that's where I'll start my part of this as the con. But I think something to consider is, there's public health is many things, right? So it's a practice, it's a mission for many of us, but it's also an institution. And so when I think of public health as the institution, as we've seen in some of those examples you gave, I think there are definite harms that come with public health, as with any large institution. So I think the last time I presented at this conference, I really acknowledged that I'm a bureaucrat, and the harms that come with bureaucracy. As Heather mentioned in the opening statement, a big piece of institutions is this kind of idea of paying for grants, right, and funding, and how it kind of forces organizations or communities to play along with what is expected by kind of doing the dance to the grant monies that are coming in. And when those funds are taken away and there's no sustainable structure, there's a lot of damage that's done to those organizations as well as the communities that it serves. So I think something to just really consider, maybe to start our discussion, is if we look at public health, capital PH, as the institutions, so health departments and federal government entities, I think really considering how we provide public health in a way that doesn't set it up so when we take away things or we don't have resources, that it doesn't immediately cause harm. So maybe I'll just throw that out as an initial starting point for my friend May Rose to respond to, and then we can go from there.
Great, thanks, Thaddeus. And it was myself who asked Thaddeus to change that slide, because as a public health researcher, I'm like, we're not an institution, it's a field, it's social science, and it's a practice. And, looking at 2020, I think 2020 was a year of public health. And if we did our job, we would not see public health. And by that, I'm saying, everybody would be safe, have access to healthcare, would be healthy. But 2020 exposed all the badness of what could happen in public health with the pandemic, social isolation, medication, mortality of the COVID-19. And then we had the Black Lives Matter, the presidential election, where you look at race and discrimination and how it's because of systemic racism and whatnot. And then you look at climate change, where Pacific Islands and communities in the Pacific are affected by typhoons, by hurricanes, and by floods. So that is all public health. The value of public health is a community thing. I was aiming to be a doctor, looking at the individual, but I became a public health researcher because you're looking at the community. You want to look at the health of the community, and the community should drive. And that's where public comes from, right? Community, and the community is a large part of public health. And if you have a healthy community, you have healthy worlds, healthy nations, healthy countries. So there is a lot of value in public health. When communities get sick, then public health, what happens to public health, and where are the gaps in public health? But for the most part, if public health is doing its job and is being healthy, and if there's funding, you won't see us. Everybody is thriving.
And I agree with that, Mary. And may I respond?
Sure.
Oh, cool. Yeah, no, I think your points are excellent. And I actually totally agree with you, because I think public health should be community driven. And I think maybe the tension from the con side, I guess, for people who are kind of hesitant about public health is that, is it always community driven, and how much community can drive these huge bureaucracies that are kind of providing the grant, the funding parts of it. So totally agree with you. And I think that's where the tension lies. And as a bureaucrat, I see that tension all the time. So I totally agree with you. I think, how do we kind of resolve that tension, or address that, right? So great points. Just wanted to kind of agree with you there and point that out.
Yeah, good job, you two. I really like that. All right, next question. And if you folks have questions, please put it in the website chat box. We will also comment on that, okay? So I'm gonna turn this to May Rose to start. Has public health earned the community's trust?
I would like to think so. I mean, because of Tuskegee and Kalaupapa and many, many other past occurrences where public health was not there, and wasn't thinking about the community. But I think we have ethic boards and clinical trials now. We have efficacy. We have vaccines that are tested and that are ran through the gamut of clinical trials and test after test after test. We have communities and diverse expertise now that can say, this is that there's evidence in this, there's science in the background. And there's more collaboration, there's more communication, there's more advancement. I'd like to think that we learn from history and we can do something about it and progress from it. And hopefully, because of all this advancement, there is some trust there. But of course, it is hard when you do remember Tuskegee and you do remember Kalaupapa, you do remember side effects of vaccines. But hopefully, as time goes on, as we progress more as a society and in science, we could eliminate certain risks. But as in public health, you want to make sure the benefits outweigh the risk. And hopefully that is gains more traction in the community's trust.
Thanks, Mayrose. So I would say that public health has especially as we look at kind of things that have happened this year, there's a lot of mistrust of public health systems. And I think it does come down, and I think you mentioned this, to communication and transparency. I always think about this moment that we had when we were developing Hawaii's first trans health report that we put out. And when we presented it to Ka'amahu, the trans leaders of Hawaii, they said, this is great, but what about cultural ways of showing data? And what about talk story? So I always think about that moment, because I think, even though we have lots of great data and expertise, for a lot of people, we live in the world of storytelling and narratives, and that's our easiest way of understanding things. So these things like Tuskegee and Kalaupapa have shaped narratives that are really hard to shake. And if we don't address that from the public health side, so not only using our expertise and our data, but also helping us shape clear narratives that are involving the voices of our community members, I think that community trust is really difficult to get back once we lose it. I look at, and everyone's seen this in the media too, which is a huge component, I think, of this trust building, especially nowadays with social media, is just that narrative of the COVID pandemic in the US, and how the narrative is that there was flip-flopping and there was a politicization of the issue as well. And so if, I would like you, I would love public health to be able to foster better trust in a truly meaningful way with our communities. But I think it's going to be a major challenge, and it continue to be, without really changing the way that public health communicates with our community members in a very transparent and very open way. And that part is probably the hardest, because I know May Rose and you and I talk about this a lot, because it's messy work and it's long work. And so maybe public health should also really start to take that longer view of investing in communities where we're not looking for outcomes for a grant that ends in 1 year, but looking at investments that bear fruit in 10 or 20 years, and how that can be the aim of public health. So yeah, just my response to that question.
Yeah, no, I totally agree, Thaddeus. I mean, Thaddeus and I are usually on the same side, and so this is very hard for me because I'm like, yes, of course. But it is true. I mean, public health does have to be more in the community. It shouldn't be in the bureaucracy. It shouldn't be in government buildings. It should be out in the community. And how do you build a trust if the community does not see you? How do you say, you know, I know that Department of Health person, or I know that medical director. If you don't see them out in the community, if they don't suffer where you're at, if they don't understand where you're lacking resources, you know, because you can't get access to the clinic, or you don't have proper brochures that are translated, or you don't have translators. So how can you trust someone that you don't see? And I always push for that. If you really want to build that trust here in Hawaii, it's important to see the person, to talk to the person. Even if we're socially distancing, a phone call goes a long way, you know. And if you can't be there, have outreach workers, send people out, and so that there is that engagement. And I think that's what is missing a lot of the heart in public health. And we're all brainiacs. But sometimes we do get lazy and we get comfortable where we're at, and we need to go out more and to build trust and engage with people and be with people. So I totally agree with you, Thaddeus.
Yeah, I think you raise a good point too, May Rose, because I think for public health providers or people working in public health, I think we don't like feeling uncomfortable. Because again, if we go back to narrative, we like this narrative that we're helping people, but sometimes we have to acknowledge that we can and maybe are doing harm, and then we have to sit with that discomfort. And so when community members come at us, like I know they've come at you, May Rose, and at me, just sitting in that moment and not trying to be defensive, but being like, I feel very uncomfortable, but how can I make sure that this is a learning opportunity, and to really respond to the community's need rather than just being like, sorry, that's what the grant is asking for. I can't do anything else for you.
Yep, and I just to jump in there as well, it's kind of like when you say it's an institution, like you did in the beginning, it's kind of like giving public health from the ivory tower, right? And going out and just hoping the community will understand. And what has to happen is that public health is a service, and that there's an extra arm and extension of having that face-to-face contact with the community, in the community where they're at. And that's what we've seen with polio virus. It wasn't like, you know, you just come to one spot and you get the polio virus. People were going out into all of these destitute communities and making it work, getting vaccines that were just easily administered through the mouth. So that's how you earn trust. You know, it's like we all love Dr. Fauci. We wish he could come to each of our organizations and to our community, and then people could have that trust in him as well. So, all right, next slide. So we'll start with Thaddeus. How does public health affect cultural practice?
This is a good one. I'm excited for May Rose to respond, actually. I mean, like, it does affect it. There was a really interesting book that I don't know if Ashley Shearer is on here, but a great colleague who works at the Community Coalition at Queens Emergency Department. She lent me a book which talked about how the U.S. kind of, in a sense, exports mental illness. So in order to provide aid, for example, after the tsunami in Thailand, aid workers came out there, and if folks didn't meet the definition of mental health, issues like trauma, they weren't eligible for services. So you have people culturally had to shift and present mental health issues in a different way, or to abandon resilient methods, right, in order to gain services. So this kind of speaks to, I think, what was earlier mentioned about, you mentioned, Peter, about people kind of shifting or changing in order to get healthcare, like for people who can't afford it, right? So I just think public health hopefully would, collaborate with cultures and communities to better both. But unfortunately, I think the way that public health is sometimes practiced is that we almost force people to kind of, I don't know, become sick in order to get services. So I think that's a really scary and nefarious and very like silent or unknown, I don't know, like it's just a very like a thing that's happening that maybe we're not always looking at. Another example I'll mention is that my friend who's a social worker says that before she can provide services, because of the grants that they're under, she has to administer 5 surveys to a client, which are very triggering because they're about sexual abuse, they're about domestic violence. So before she can even provide services to help someone, she's required already to trigger them for the under the auspices of research and grant funding. So I think, public health has opportunities, but can also shift how things are practiced and how people engage with the healthcare system. So May Rose, what do you think?
I think I agree. As a researcher, we do like collecting data, and sometimes that data it helps us a lot with providing services or suggestions of interventions. And that's why we collect so much data. But I understand that we need to be more transparent and share that data back to a community. What has happened to the data after you gave it to me? So I understand that. But regarding how public health affects cultural practice, we saw that in COVID-19. Native Hawaiians, Pacific Islanders, Filipinos, Pacific peoples in general are very collectivistic. We love coming together to grieve when someone has passed away, when someone is hurting. We like to celebrate when someone hit a milestone, and to give appreciation, show appreciation, give hugs. Now we have to wear masks. We can't see their faces. Now we have to socially distance. And so when public health tells you to be protected, to be safe, you have to socially distance, you have to self-isolate, you have to be away, you can't celebrate. That affects cultural practice. That goes against everything we do in our culture. But at the same time, though it's counterproductive, and it counters and it conflicts with what we practice, it also keeps us safe. So public health is trying to say, for you to be safe and for your family to be safe, you have to do these things. So in a way, public health helps, even though it's conflicting with our culture. This also helps us as a community to say, maybe this is not the right time to come together. And then cultural practice could be also reversed, right? Cultural practice could affect public health by saying this is not the right survey to give out to a Filipino community versus a Chuukese community. Not everything's cookie cutter. Everything has to be customized and tailored to the community, to the culture. So I think it goes both ways, and there needs to be more flow. I totally agree. There needs to be more flow, and it just can't be one end all be all, and not everything lies in the public health authorities.
Yeah, and I also want to say, as a Pacific Islander, especially during the COVID pandemic, it's very, very hard for us Native Hawaiians, Samoans, Chuukese, with funerals, parties, all of those things that are so family tied together, and to be separated and wear masks was extremely, extremely difficult. And for the health department to put out those ads, I don't know, I feel like they really took in community input to put the ads out there, especially the Samoan one hit me when it was that Samoan elder lady that's well known, where they had a funeral, and she acknowledged that yes, it's a funeral, we all must be there, but there's alternative ways of coming. And so they showed the casket outside and people were driving by to pay their respect. I mean, that really hit home for me in my community, and felt like they were really speaking and addressing us rather than blaming us for outbreaks and such. So next slide. All right, data. Thaddeus, data queen, should role of data change?
First of all, I want to acknowledge my fellow data queen, May Rose Dela Cruz, doing actual research. So, props to you, May Rose. I think the role of data should change, and knowing May Rose in our discussions, she probably would agree with me in many ways. So, like May Rose said, I will acknowledge like data is really important for public health. We just need to know like where things are happening. We need to know if things are effective, and we need to use data to justify policy things so that we can go back and get things for our community members. However, as I already alluded to, I think it's the way we collect data and the way we share data can be problematic for the health department or any public health bureaucracy. An easy example is, how people collect or not collect sexual and gender minority data. For us, we're doing projects where we're trying to show the impact of substance use on sexual and gender minority people in Hawaii, but there's no data collected. So we don't have opportunities to even show that it's impacting our communities, even though anecdotally we see it all around us. So, and then I also want to give props to Tertia Koo from Papalo'akahi and the folks working with CREA. So looking at, indigenous ways of collecting data that is culturally appropriate and that's empowering rather than disempowering, right? So how do the people themselves provide the data and shape these narratives? So I really love qualitative data or that talk story element. And that's come up a lot in our discussions with community members on how we can still have that quantitative piece, but make equally important that talk story narrative part of it. So what do you think, May Rose, about that?
Well, of course, I'm going to agree with you. But on the flip side, I would say yes and no. I think, with COVID-19, there's all these platforms and dashboards now. People can see the data. And so the data is there. And I think the methodology of how it's conveyed should be changed. The translators, the people who are communicating the data should be changed. Keep the data, show the data, but then translate it, say it in a way so the community understands. Say it so that they can own it and say, yes, that's reflective of my community, or no, that's not reflective of my community, and make them, give feedback on it. That's the thing with data. We collect the data, we show it, and they're like, oh, pal, move on, let's collect more data. And, oh yeah, it just reinforced this data. But there's not a lot of feedback. So I think maybe that's the role that should change also. But at the same time, I think communities now are being savvy with data. And so not in totality to change the data, it's just that the mechanisms of how it's conveyed and how it's shared should be changed. It gets stuck in the big academia world. It gets stuck in people who could buy data, the media, everybody except for the community. So the data is there. It should not totally be changed. It's just how we share the data should be changed, and let the community say, like, I understand this data, and let me tell you what it means to me. So maybe in a way it should be, that's a different role that the community takes. Maybe it's a new role. I think I like the idea that it's give the data to the community. We're smart enough to tell you what it is about. Don't leave it to the scientists, the epidemiologists, to the bureaucracy to tell us what it is about. So I think it's time for the community to say what it is.
Awesome. Hey, we have a comment in the chat. Let's see. A barrier in public health, mainly life insurance in the event of death. Tips for denial when people admit their mental health.
These are great questions. I think these are important questions, and we talk about prevention. I love public health because we're in the realm of prevention. And a lot of us are reactionary most of the time. Oh, I have a cough, I'm going to go to the doctor. Or like, oh, you know, I broke my arm, I'm going to go to the doctor or emergency room. But we don't plan for it. You know, don't put that ladder there or you're going to fall down and break your arm. You know, you want to make sure we holistically prevent and plan for things. And you know, a lot of Pacific peoples, Pacific traditions, and Filipinos do this, like, oh, I don't want to talk about death, or it's gonna be a curse, or we're gonna bring it upon ourselves. But I think we have to also plan for the well-being of our families and say, what will happen to you? What will happen to our family? So there's the talk about life insurance. You know, you have to plan, and it's just a prevention. It is public health. You have to plan for that. And regarding mental health, that is the, you know, we, aside from public health trending in 2020, 2021 should have mental health be trending. We should talk about mental health because we're all affected because of the pandemic, and we should bring it out, expose it to the light, and see what we can do about it, and how we can contribute as a community to mental health, and to unstigmatize it, and to put in the realm of harm reduction, you know, and cultures they can't deny it anymore. Cultures have to bring it up because it's affecting every aspect and every life and every culture. I think hopefully I answered that question. Thaddeus?
Yeah, agree as always. And yeah, and then I'll add, you know, life insurance companies, health insurance companies aren't necessarily public health oriented. They're oriented in a different direction, usually maybe more economically. So this is where there's an opportunity to, you know, when these issues come up, reach out to public health champions or community champions and see if they have leverage points to help change these larger systems. So a lot of public health folks do try to make change in the insurance realm because of the harms that can come with certain insurance decisions. So definitely start to kind of build those bridges with folks. As much as I'm the con of public health in this discussion, there are a lot of great people out there doing great work and who are willing to work with you and figure ways out. Again, also acknowledge that time is not always short in public health world. In true impact, so it could take many tries, but at least to start the discussion to move that forward. So I don't have the answer now, but hopefully someone will. And you can always reach out to me if folks want to try to connect with someone else in that realm. So thanks.
Oh my gosh, I was on mute. I thought I would not be that person. But hey, we have about 10 minutes left. So let's skip to the next question. Next slide. How can we reduce the harms of public health? And then we'll answer a few more comments that come up. But I think this is a really important one because I love public health. I was a part of public health and I see both. So I'd like to open it up to either of you. How would you address this question?
Oh, can I go first, Thaddeus? I have two things. One is collaboration. I say collaborating with medical, governmental, political, and public health in general. I think, you know, we do, there's not a lot of talk about public health. We have to bring it back to communities and say, like, this is an issue, you know. We can't just be all reactionary. We have to talk about substance abuse. We have to talk about mental health. And we can't find the answers in just the medical institutions or in the governmental institutions. It has to be multidisciplinary. It has to be collaborative. And all community members, you know, Native Hawaiians, Pacific Islanders, LGBTQ plus clergy, places of worship, enforcement. Everybody has to be in that discussion. And the second one is unpoliticizing public health, regardless of what party is in control. There, and we heard it through the introduction, like monies are being taken away for HIV and harm reduction in general. Regardless of who's in control, who's in power, monies for public health should not be touched. And there should be a consensus. I mean, this is an ideal world, right? This is, I wish this would happen, and just have a big pot of money for just public health, and that should not be touched. It should be given equally to different states and different populations, especially the most disparate ones. So unpoliticizing public health, if you're going to talk about COVID-19, really push with what the experts say, wear a mask. Everybody wears a mask, and not take it off when there's a political rally, so every time, and also if there's stigmatization involved, it seems like it'll always be political. So I think we have to make sure that there's a clear line between what the community and what the populations need regarding their health, and it should be untouchable and not be up for debate. So unpoliticizing that.
I think I have a couple points too. So some things that maybe folks attending could take away with is especially for people who are working in public health, to really be willing to be uncomfortable and to sit in that discomfort and see, and to always do active work in terms of trying to make sure that you are not doing harm to your communities in the way that you're practicing public health. I think, like May Rose said, we can become very complacent and we just kind of focus on the task at hand. But just know that because public health has opportunity to do so much good, it also has opportunity to do so much harm. So really taking that active work and looking and seeing how our programs and our interactions with people can do harm, and how to change that. I think the most dangerous narrative sometimes is the fact that we're done and that we're good and that I'm a good public health person, I'm helping people. But if I don't look and see how my actions can continue to harm people, I think I'm already starting to do harm and going down that road. So really continuing to practice that intentionally, I think, is very important. For folks who aren't working in public health but who are affected by it, I would say call us out. Nicely, hopefully, but we should be able to take it. So like Heather did this morning, just state what's happening. We can't help if we don't know the community issues, and we need to be uncomfortable sometimes. This is not easy stuff that we're trying to deal with. Stop addressing a pandemic is not easy. So there will be tensions, and that's okay. So calling public health out, or at least communicating with public health to let them know what the issues are. I know sometimes it's tiring and folks are tired of having to battle for their own communities. But if you have that energy, I would just reach out to public health folks that you know and call us out. And so those are just my 2 action items that you folks maybe can take away after this.
Awesome, guys.
I think there's a question too. Oh, but one more thing is to be actively involved. I mean, policy drives us in public health. Of course, vote, but also if you feel impassioned for a certain policy, where it's tobacco use or vape use or whatnot, or vaccination, really look at your politicians, your representatives, and talk to them. I talk to my politician all the time. We're Facebook friends. I know that kind of dates me, right? But just ask them, where are you at? What is your position on this? And be engaged. And if your children see you doing that, they'll be more engaged and they'll be more inclined to let it be an ohana thing, a kako thing, right? Let everyone be engaged. And the more we're engaged, we'll be a better and stronger community. And we have politicians that'll serve us. And the question was, when folks return to or are working in shared workspaces, how does one encourage masks? Dr. Jack Barrell just released a study that showed that in Hawaii, we don't wear a mask for our sake. We wear masks for others. It's that collectiveness and how we want to protect each other. I think just a simple reminder. I mean, I have a big work area too at the University of Hawaii. I mean, just to enter this space, you have to wear a mask. Sometimes policies will help with that. So just encourage, oh, could you protect me? Or don't forget your mask. You don't have to be rude about it. But I think, and once people see everyone wearing masks, I think I see it so frequently here. Hopefully that helps your space, and that will help your workspace, and it will help each other. We'll help each other out too.
Yay, thank you. Next slide. So we've come to the end of our session. I'm glad we didn't have the royal battle royale happening. I really, really thank you too for giving such great insight on both sides of public health. And it's really neat to see that even though maybe you were super assigned that, you could see both sides, or you're both sides for a super go for it. Public health, I'm sure everyone that's in here has some place in the role of what they do for our community. So kudos to all of you. And especially in this age of social media, I don't think it's public health necessarily getting picked on, but people just taking random information and just applying it to things that just don't make sense to a lot of us. It's a very difficult and trying time. So we got to navigate that as best as we can. There is going to be an evaluation that pops up, but I just want to say mahalo to all of you for joining this. And we're so excited about this harm reduction conference, and encourage you to jump into some other exciting ones. I know we will. With that, we would like to say ahui ho and malama pono. You guys take care.
Thank
Thank
you.
you.
Mahalo.
Good to see you guys.
Yeah.
Great to see you guys.
Thank you.
Mahalo to the 130 of you that joined.
Mahalos.
Awesome. Thank you, Peter. Thanks, May Rose. And thanks, Darren.
Yeah,
Thanks,
definitely.
Thaddeus,
That was
Darren,
fun.
was
Andrew,
good.
Peter.
It
May
worked.
Rose, we should do something like this for your next class. We should do it every
We
week.
should. I mean, we should make it more controversial.
Yeah, we should be more like,
Yeah.
We're so nice to each other.
I know, but I think when we're in the space, at different meetings, you and I, we're on the same side all the time, and we cause a ruckus.
Yeah.
And I like that.
Oh, and thanks, Darren, for helping us moderate. That really helped.
Thanks, Darren. And now Peter and May Rose, you know each other too, so.
Yeah.
Yes,
so
Peter.
excited.
It'll be great to meet you.
I know, definitely. I love data people. They're my favorite. It's my inner nerd. I really wanted to show that fireworks video. Oh my gosh, this year was crazy.
We just had to look out our window. That was our fireworks video,
Yeah. Just imagine, those are kilos of coke that come in, and black tar, and illegal hormones. It just all floods into our state like nothing. I just
Yeah.
Well, I'll see you folks on other sessions, I guess.
Yes,
Yes.
definitely.
Please take care.
Okay. Happy New Year.
Happy New Year.
Bye.
Aloha.